Good afternoon, everyone, and thank you for being here. My name is Myra Jones-Taylor, and I'm the Chief Policy Officer here at 0 to 3. While we are all disappointed that we cannot be together in person today, assessing the past year and looking toward what is undoubtedly a brighter future, I am thrilled that you are able to join us for our third annual State of Babies Yearbook release. We have a thought-provoking agenda in store for you today. First, I'll spend some time walking us through the new data, sharing what we've learned from our research. And after that, we will move into several discussions with experts exploring 0 to 3's three policy domains: good health, strong families, and positive early learning experiences. Panelists will share how policymakers can support the development of our nation's infants and toddlers. Along the way, we'll hear from families who have participated in Strolling Thunder, sharing their experiences before and during the pandemic. But before we can discuss how to move forward, let's dig into the data and talk about what infants and toddlers have experienced in the past months and years. The State of Babies Yearbook is a go-to resource that tells us how babies and their families in every single state, and hopefully someday the 51st state of Washington, D.C., are faring on more than 60 indicators of well-being. Our goal in developing this resource was to give policymakers and advocates the information and data they need to understand how babies are doing across the country, where they are doing well and where they are facing challenges. It also serves as a tool for policymakers to shape those policies that we know improve outcomes for young children. The yearbook draws from national databases where every state is represented, databases that of necessity lag a year or two behind. So I want to be clear, the data in the current yearbook is still from before the pandemic. To augment our story and gain insights to how families have fared over the past year, though, we drew on an important new resource, the Rapid Assessment of Pandemic Impact on Development Early Childhood Household Survey, or as we call it, the Rapid EC project, an early childhood family well-being survey designed by our partners at the University of Oregon to gather information throughout the COVID-19 pandemic. Rapid EC data and yearbook indicators come from different data sets, so looking at them together gives broad indications of how conditions have worsened over the course of the pandemic. Telling the story of America's babies is more important today than ever. We found that even before the COVID-19 pandemic, the littlest among us did not have the supports they needed to thrive. The pandemic has wreaked havoc on the conditions that contribute to babies' development and family stability. We didn't need a crystal ball to predict who would be impacted most. We just needed to look at what the experiences of babies and families have long been telling us. Because Black and brown families face systemic barriers to wealth accumulation and high-quality health and childcare, the pandemic hit Black and brown babies harder than most. Babies of color and those families with low income continue to face unacceptable barriers to resources that promote good health, strong families, and positive early learning experiences. It's high time we implement permanent policies that will address these barriers and ensure all children have a strong start in life. And we believe the pandemic has brought us to the moment where bold national action is not only demanded, but possible. The 2021 yearbook emphasizes the national policies babies and families need, drawing from 0 to 3's federal policy agenda. This is our third State of Babies yearbook and the second to make equity a major focus. COVID-19 has made that focus even more crucial. More than half of America's babies are children of color, and 2 of every 5 infants and toddlers live in families with low income. Every day, we hear stories about families who are struggling to keep their heads above water, families who were forced to choose between going to work and taking care of children and family members at home, families who were seeing their loved ones disproportionately impacted by the COVID virus, living in hot spots and dying at disproportionately higher numbers. The data are clear. Even before the pandemic, our country was not ensuring our babies had what they need to thrive. Not just our national policymakers, but every state, city, town, and neighborhood needs to do better for our babies and take bold national action to set all our babies up for success. In every state, significant disparities driven by historical and structural inequalities are apparent for babies and families of color. By nearly every measure, children living in families with low income and children of color face the biggest obstacles. The current crisis did not create these disparities, but it has further exposed and exacerbated them. Diving into the numbers, we see that the data foretold who the pandemic would hurt most. But we also see that when we confront that data head on, when we craft policy solutions that explicitly acknowledge and address these inequities, we can build a path toward a better future. So let's start with the one that many might find most relevant this year: good health. It's common sense. Physically and emotionally healthy babies are more likely to become healthy, stable, and successful adults. Good nutrition, nurturing relationships with parents and caregivers, and high-quality medical care all support sound bodies and minds, influencing all areas of a child's development. But the State of Baby's Yearbook shows wide variations in babies' health outcomes and their families' access to care. The United States lags behind other peer nations on several indicators of well-being, with wide disparities in maternal and infant mortality rates and birth outcomes for children of color, especially Black mothers and infants. Nationally, maternal mortality occurs at a rate of 17 deaths per 100,000 live births. But for Black women, it's more than 37 deaths for every 100,000 live births. We also know that 91% of infants and toddlers had a well child visit in the last 12 months, which means that close to 1 in 10 did not have a visit. And babies in families with low incomes were less likely to have had a well child visit than babies in families above low income, signaling barriers to access. And keep in mind, these statistics predate the pandemic. We know from the Rapid EC project that due to circumstances related to the pandemic, 38% of families reported missing a well baby or child visit since the pandemic started. Black and Latinx families were significantly more likely to have missed a well baby or child visit than the average. According to Rapid EC findings, fear of contracting COVID-19 during such visits, which is understandable among the population most vulnerable to infection, was the driving force behind these missed visits, with childcare for other children a distant second. But missed visits are while developmental concerns are often picked up, as well as when crucial vaccinations occur. So children may have developmental delays that won't be picked up until later. And we know that parent mental health was suffering even before the pandemic. 20% of mothers reported less than optimal mental health prior to the pandemic, but mothers with low income reported less than optimal mental health at even higher rates than mothers above low income. The often stark disparities that we see in both outcomes and access to healthcare tell us that our next step must be broader policies to ensure our health system can be the front door for strong early development. We also need to fight for strong families in all their forms. Babies need stable families and strong relationships to grow. Nurturing relationships together with meeting basic needs and supporting strong physical and emotional development can lay the foundation for a strong start in life. For too many children, the issues that follow them throughout their lives start with the challenges their families face in providing a secure home and a community that supports their development. Nearly 1 in 5 babies have already had one adverse childhood experience, such as experiencing poverty, or racism, abuse, or neglect. The incidence of adversity is markedly higher, nearly 1 in 3, among babies and families with low income. Among other lasting effects, these adverse childhood experiences are linked to chronic health problems, mental illness, and substance use in adulthood. Families with young children struggle particularly with a lack of economic security. Even before the pandemic, young children were more likely to live in poverty than school-age children. And when families have limited access to social and economic resources, it is often challenging to provide their babies with the basic needs required to thrive, which in turn can increase emotional stress that affects babies' well-being. Before COVID-19, as many as 40% of infants and toddlers lived in families with low income, or $54,000 for a family of 4, meaning they did not have the financial resources to make ends meet. For Black and American Indian, Alaska Native infants and toddlers, that proportion is 3 in 5. Think about it. That's an astonishing number of babies whose families are working hard, but are still having a hard time making ends meet. According to Rapid EC findings, The pandemic has since placed extraordinary burdens on families with young children, as caregivers struggle with job and income loss, reduce access to childcare and healthcare, and basic needs insecurity. Pre-COVID, more than half of families with low income lost income during the pandemic. And though the CARES Act, unemployment benefits, and eviction moratorium buffered early economic fallouts, many families experienced financial hardships when those benefits expired last summer. And one point in particular shows us another breakdown in racial equity. 1 in 6 babies nationwide live in crowded housing, which we know jeopardizes development. But babies of color are more likely to experience crowded housing than the average. 1 in 4 Latinx babies and 1 in 5 Black babies live in crowded housing. And nearly 25% of children in families with low income live in crowded housing, compared to under 9% of those above low income. And nearly 7% of young children in families with low income live in unsafe neighborhoods, as opposed to almost 4% in families above low income. It's our duty to do everything we can to help families provide their babies with opportunities for positive early learning experiences. Learning is central to healthy development, and it happens right from the start. Babies learn through the magic of everyday moments, such as play, exploring the world around them, and having delightful positive interactions with the adults in their lives. And these early experiences are crucial for supporting healthy emotional and cognitive development, and helping babies grow into strong learners and successful adults. As a nation, we are simply not doing enough to ensure every baby has the support they need for positive development, whether through time with their parents or high-quality early care and learning settings when their parents are working. Infant childcare is too expensive for many families, exceeding the cost of college tuition in more than half of states. And despite the high cost of childcare, few families receive financial assistance for it. Just 4% of families with low incomes and moderate incomes that could use help to pay for childcare actually receive a subsidy. And only 1 in 10 eligible infants and toddlers are able to benefit from Early Head Start's proven comprehensive approach. And states are simply not setting floors for childcare quality high enough. Only one state, Connecticut, my former state, sets key standards at the level of Early Head Start. And while we see many indicators that suggest babies may be at risk for developmental delays, and the pandemic increases those fears, only 6 states provide preventive early intervention services to children placed at risk for developmental delays or disabilities. And of course, racial disparities again strike at efforts to improve positive early learning experiences. On average, families of color are 2 to 3 times more likely to be affected by poverty than white families, making them less likely to afford the high cost of infant and toddler care, and more likely to live in economically disadvantaged communities that lack access to high-quality care. COVID-19 and the resulting economic fallout have brought national attention to caregiving professions in general, and childcare in particular. More than half of families surveyed by the Rapid EC Project report using some form of non-parental childcare for their infants and toddlers prior to the pandemic. But that number dropped to around 26% in early April as parents lost work and over 60% of childcare centers across the country shut down. Now the landscape for parents and providers has shifted. Some parents are still unemployed or can't afford care, and some providers had to close their doors for good. Parents' use of care has shifted with more use of family and friends. Many childcare centers reported struggling to remain open or to reopen due to the increased cost of implementing public health measures, insufficient federal and state aid, and lower revenue from operating at limited capacity. All of these factors place the childcare system, which as a nation we have now come to realize is infrastructure and essential to our economy, but place them on uneven and more unstable ground. Today, we are here to discuss how to develop those policies and direct resources where they are needed most, and implement those approaches that we know will set our babies up for success. We are here to discuss policies that are built on the science of brain development and budgets that put infants, toddlers, and their families first, so we can ultimately ensure all babies have good health, strong families, and positive early learning experiences. The State of Baby's Yearbook makes it clear that our nation has been complacent for far too long and has looked the other way way too often when families have struggled. Our babies deserve more than what we're giving them. We as a country need to do everything we can to make the potential of every baby a national priority. The time has come for federal and state policymakers to take bold steps on policies for families that befit the wealthiest, strongest nation in the world and truly build for the future through high-quality childcare and early learning supports, measures that ensure economic security, support for strong families, a system that fosters strong social emotional health, and meeting basic needs for health and well-being. To simply return to the way things were is unacceptable. To do better for our babies and our nation's future, we need Congress and state leaders to seize the opportunity to create the forward-looking, family-centered policies that our nation has lacked. Policymakers need to put policies that help babies and families first, including the expanded child tax credit, paid family and medical leave, expanded medical care, and a comprehensive, high-quality childcare and early learning system. So what can you do to help make this a reality in our country? Babies aren't able to stand up and testify in a congressional hearing, although some may argue that they'd be much more compelling than most of the witnesses in those sessions. They need us to be their voices. They need you. And it might seem intimidating to take those first few steps as an advocate, but I promise you, you can do it. And we are here to help with tools, resources, and guidance. You can use this website, stateofbabies.org, to see how your state stacks up and where significant disparities exist and the opportunities available for babies of color to thrive. You can be a big voice for little kids, using that information to push your policymakers to enact solutions to help infants and toddlers overcome early life challenges. Thank you for joining us today. Check out your state's data and learn how you can take action to support infants and toddlers from the State of Babies Yearbook 2021.